Most people completely miss sign number 3. Your mother forgets where she parked the car. Again. Your father asks the same question several times in 1 hour. You may think this is just normal aging, but what if these moments are early warning signs of something far more serious, something doctors can actually help with if it's caught early? Vascular dementia is the second most common type of dementia after Alzheimer's disease. It affects millions of people over the age of 60. What shocked me during my research is how often the earliest signs are ignored. Many families miss them for months, even years. By the time medical help is sought, significant brain damage has already occurred. In this video, I'll share 8 early warning signs that every person over 60 and their families should recognize. Sign number 3 is so subtle that even people living in the same home often miss it. Once you know what to look for, it becomes impossible to ignore. Before we begin, one important reminder. This video is for educational awareness only. These signs do not confirm a diagnosis. If you notice any of them in yourself or someone you love, you must speak with a medical professional. Only a doctor can properly evaluate and diagnose vascular dementia. Let's begin. Sign number 8. Sudden difficulty with planning or organizing. This is not about forgetting an appointment or misplacing your keys once in a while. This is a sudden change in the ability to complete familiar tasks. Imagine this. Your father has made the same Sunday breakfast for years. He knows the routine by heart. Then one morning, something feels off. The food is burning. Steps are skipped. He seems unsure what to do next. This is called executive function decline. In vascular dementia, small strokes can suddenly damage the brain areas responsible for planning and organization. Unlike Alzheimer's disease, vascular dementia often appears in noticeable steps. One day, things seem normal. The next, abilities suddenly drop. Families often compensate without realizing it. You take over the bills. You organize medications. You plan meals. It feels helpful, but it may be hiding a serious warning sign. Sign number 7. Increased confusion in the evening or at night. During the day, everything seems fine, but as evening approaches, something changes. Confusion increases. Disorientation appears. The person may not know what day it is or whether they've already eaten. This is often called sundowning. It's not just tiredness. As the brain becomes fatigued, areas affected by poor blood flow struggle even more. Reduced lighting removes visual cues, making orientation harder. Because this happens gradually each evening, families often dismiss it. But persistent nighttime confusion deserves medical attention. Sign number 6. Trouble finding common words. Everyone forgets a word sometimes, but this is different. A sentence starts clearly, then suddenly stops. The idea is there, but the word is gone. A fork becomes that thing you eat with. A refrigerator becomes the cold food box. This can happen many times in one conversation. These language changes often appear suddenly and vary from day to day. The person knows something is wrong, which can lead to embarrassment and withdrawal. Sign number 5. Difficulty following conversations or TV shows. A show they've watched for years suddenly becomes confusing. They ask what's happening, who that character is, why something matters. Then they ask again minutes later. This isn't a hearing problem. It's a working memory problem. The brain can no longer hold and connect information in real time. Busy conversations become overwhelming. Background noise feels unbearable. The person may withdraw socially, often mistaken for depression or disinterest. Sign number 4. Problems with depth perception and spatial awareness. The person misjudges distances. They bump into doorways, spill drinks, struggle with stairs or parking.
Their eyes may see clearly. The problem is how the brain processes visual information. This greatly increases the risk of falls and accidents.
Sign number 3. Subtle changes in walking or balance. This is the sign most people overlook. Walking is controlled by the brain. Early vascular damage can cause slower walking, shorter steps, hesitation when turning, or poor balance. These changes often appear years before obvious memory problems. Families usually blame aging or joint pain. But when walking changes appear alongside cognitive symptoms, they require medical evaluation.
Sign number 2. Sudden emotional changes. A calm person becomes easily angry. A minor moment triggers tears. Emotional reactions feel intense or completely inappropriate. These are not personality changes. They are neurological symptoms. Damage to the brain's emotional control centers removes the ability to regulate feelings. Sign number 1. Sudden urinary urgency without infection. This surprises many people. Bladder control is regulated by the brain. Early vascular damage can cause sudden urgency or accidents without any urinary infection. This symptom is often dismissed as aging, but when it appears with other changes, it can be one of the earliest neurological warning signs. What to do next? If you recognize multiple signs, don't panic, but don't delay. Document what you notice. Schedule a medical appointment. Request a full evaluation. Managing blood pressure, diabetes, diet, exercise, and smoking can protect brain blood flow and slow further damage. Vascular dementia is different. Because it's caused by blood vessel problems, early action can change the outcome. Recognizing these signs early can protect someone's independence, cognitive function, and quality of life.